Hello, everybody. Today I will speak about the possibility to utilize different natural methods, part of integrative medicine, for the prevention and treatment of chronic disease. My presentation at the conference, the international conference, Medicine Integrative Today, which was organized in Sibiu in the period 19-20 October. The title of my presentation, Natural Therapies Useful in the Prevention and Treatment of Chronic Disease. Some words about the role of integrative medicine in this direction, in this idea to prevent and treat different chronic disease. Integrative medicine plays a significant role in both the prevention and treatment of chronic disease, such as heart disease, diabetes, especially type 2 diabetes, different form of cancer, and autoimmune disorders, which are often very complex and multifaceted. Integrative medicine approaches these conditions, these problems, these great health problems, by addressing not only the physical symptoms, but also the underlying causes and the overall well-being of the individual. But the question, what are the most important natural therapies, traditional therapies, part of integrative medicine? First of all, it's necessary to mention the older Ayurveda and traditional Chinese medicine, acupuncture, part of TCM, apitherapy, which use bee products in prevention and treatment of the disease. Aromatherapy, important part of integrative medicine, which utilize with very good results essential oils, volatile oils in this scope, or diet therapy, which is an important alternative, important integrative medicine, especially in prevention, but also in the treatment of some chronic disease like cardiovascular disease, type 2 diabetes, obesity, etc. Balneotherapy, or different anti-stress therapies. And I must mention, because we are now at a conference in Sibiu, homeopathy. In Sibiu was the city of Hahnemann, the founder of homeopathy. Phytotherapy exists very important tradition, rich tradition in the utilization of medicinal and aromatic plants for the treatment of disease. Also music therapy, massage therapy, different form of massage, which are very useful in prevention and treatment of chronic disease. All these therapeutic methods are part of integrative medicine and are very well utilized in for the treatment of this disease, which create very great health problem and social problem all over the world. What are the most common chronic disease worldwide? Everybody knows. Now, cardiovascular disease are in the top. Also, different form of cancer, chronic respiratory disease, diabetes. I speak especially about, I mention especially type 2 diabetes, chronic kidney disease, neurological disorders, obesity, which really a great health problem. It's a great problem, especially in Western countries, and a great risk, a major risk for development of cardiovascular disease, of diabetes, and so on. I must to mention mental health disorders, and osteoarthritis. We will discuss in the next minutes all about this chronic, most common chronic disease worldwide. First of all, cardiovascular disease, including heart disease, stroke, which have consistently been the leading cause of death globally. They encompass conditions like coronary artery disease, hypertension, and heart failure. Lifestyle factors such as bad, poor diet, physical inactivity, smoking, and excessive alcohol consumption contribute to the development of cardiovascular disease. Different form of cancer. Cancer is a group of disease characterized by the uncontrolled growth and spread of abnormal cells. Cancer ranks among the top causes of death worldwide. Common type of cancer include lung cancer, breast cancer, colorectal cancer, and prostate cancer. Cancer risk factors include tobacco use, especially for lung cancer, unhealthy diet, for example, for colorectal cancer, exposure to carcinogens, and sure genetic factors, predisposition to this different form of cancer. After some words about chronic respiratory disease, such as chronic obstructive pulmonary disease and asthma, which contribute significantly to the global burden of disease. Exposure to tobacco smoke, indoor and outdoor air pollution, and occupational hazards can increase the risk of these conditions, of this disease. Diabetes, particularly diabetes, type 2 diabetes, has seen a rapid increase. It's like a pandemic, rapid increase in prevalence globally about when we discuss about type 2 diabetes. It is characterized by elevated blood sugar levels and can lead to various complications, including especially heart disease, stroke, kidney disease, and vision, eye disease. lifestyle factors, including poor diet and physical inactivities specific for the modern people, play a major role in the development of type 2 diabetes. Chronic kidney disease is a growing global health concern, which is often associated with conditions like diabetes and hypertension. Chronic kidney disease can progress to kidney failure, necessitating the dialysis or transplantation. Prevention strategy, very important. Prevention strategies include blood pressure control, diabetes management, and a healthy lifestyle. Neurological disorders, neurological conditions such as Alzheimer's disease and different other dementias, as well Parkinson's disease, have a significant impact on global health. This disease predominantly affect older adults and can have profound effects on cognitive and motor function. Obesity. Obesity is not a disease itself, but really a major factor for several chronic diseases, including especially cardiovascular disease, type 2 diabetes, and some form of cancer, like breast disease and prostate and breast cancer. The global obesity epidemic has raised concerns about its impact on overall health and the healthcare system. Mental health conditions, mental health disorders like depression, anxiety disorders, and schizophrenia contribute to the global burden of disease. These disorders have implications for individual well-being, quality of life, and overall health care cost. And finally, some words about a chronic disease specific for elderly, for old people. Osteoarthritis is a degenerative joint disease, which is common cause of pain and disability, particularly among older adults. It can affect various joints such as knees, hips, hands, etc. Another question which I want to answer you is how integrative medicine, how natural therapies, these soft therapies contributes to prevention and treatment of chronic disease. First, we will discuss about prevention of chronic disease, which is the most important. Prevention is basic. Integrative medicine combines conventional medical approaches with complementary therapies to prevent chronic disease and focuses on lifestyle modifications, nutrition, stress management, and alternative therapies, the utilization of natural traditional therapies, which I mentioned before in the introduction of this presentation. Through this integrative approach, individuals can proactively reduce their susceptibility to chronic disease and improve their overall quality of life. Quality of life, another very important idea, quality of life to maintain the quality of life at a good level at old people, at elderly. It is very important to prevent by preventing this disease, chronic disease. In prevention, an important role have lifestyle modification. Integrative medicine emphasizes lifestyle factors like nutrition, physical exercises, stress management, and sleep as crucial components of disease prevention. Patients are educated, necessary to educate the patients. Patients are educated and empowered to make healthier choices in their daily lives. Nutritional guidance is very important. Integrative medicine practitioners provide personalized dietary recommendations based on a patient's health status and individual needs. Nutritional intervention can help prevent and manage chronic conditions like diabetes, type 2 diabetes, and different heart disease. Stress reduction. Chronic stress is a risk factor. We know very well is a risk factor for many diseases, for many chronic disease. Integrative approaches often incorporate stress reduction techniques such as mindfulness, meditation, yoga, etc., to mitigate the impact of stress on health. Integrative medicine considers environmental factors and toxins that may contribute to chronic disease. Practitioners of integrative medicine may recommend reducing exposure to harmful substances to prevent illness. Genetic risk assessment. Integrative medicine may use genetic testing to identify an individual's genetic predisposition. Yes, everyone have a genetic predisposition to certain chronic disease. This information can guide preventive strategies for the future, for the next years. If the prevention was not efficient, the second step is the treatment of chronic disease. Integrative medicine combines conventional medical treatment with evidence-based complementary therapies to address chronic disease comprehensively. It focuses on the whole person, considering physical, emotional, and lifestyle factors. Integrative medicine strives to improve the quality of life for individuals living with chronic disease. Integrative medicine combines conventional medical treatment with complementary therapies like acupuncture, like aromatherapy, apitherapy, chiropractic care, herbal medicine, phytotherapy, different form of massage, which are really very, very efficient, etc. These therapies can help manage symptoms, improve quality of life, and reduce the side effects of conventional treatments. Pain management is really one of the most important way to help the patients who suffer of different chronic disease. Chronic pain is a common symptom of many chronic disease. Integrative medicine offers various pain management techniques, including acupuncture, aromatherapy, physical therapy, and mind-body practices to reduce pain and improve function for a better quality of life of these patients, of these persons with which suffer different chronic disease. Mind-body medicine, mental and emotional well-being is integral to managing chronic disease. Techniques like meditation, biofeedback, yoga, and cognitive behavioral therapy can help patients cope with stress, with anxiety, and depression associated always with chronic conditions, with different chronic disease. Nutritional support. Integrative medicines employs individualized nutrition plans to support management of chronic disease. For example, dietary changes may be recommended for diabetes, for cardiovascular disease, for autoimmune disorders, or different inflammatory conditions. Holistic care. Integrative medicine treats the whole person, not just the disease. It addresses not only physical physical symptoms, but also emotional, social, and spiritual aspects of a patient's well-being. This holistic approach can improve the overall quality of life for individuals with chronic disease. Patient-centered care. Integrative medicine. The practitioners of integrative medicine encourages active patient participation in treatment decision. It's like a collaboration between the integrative medicine practitioner and the patient. It is a participation in treatment and good treatment decision, fostering a sense of empowerment and self-care. Patients are often motivated to make healthier lifestyle choices and adhere to treatment plans. Some conclusions. Integrative medicine complements conventional healthcare approaches by offering a more comprehensive and patient-centered strategy for both preventing and managing chronic disease. Integrative medicine recognizes the connections between physical, emotional, and environmental factors that contribute to chronic illness and strives to address these aspects to improve health outcomes, health recommendations, and overall quality of life. And finally, thank you very much for your attention and for your participation to our conference, Integrative Medicine Today in Sibiu.